post-COVID-19 and should be capitalized on. The next point that I would like to highlight is the importance of population health and household and community resilience. COVID-19 has shown us once again that vulnerability to a pandemic or to any health emergency is not uniform across society. So for example, those who are obese or live with non-communicable diseases are much more likely to have severe COVID-19, and we are going to see more and more the rise of syndemics. Air pollution is becoming an increasing threat in many parts of the world, which is why we have made green recovery a key priority for the bank. I earlier referred to the data from the GFF on disruptions to essential health services, for which the data also showed that demand side barriers play an important role. So for example, financial barriers where people no longer had money for transport to facilities due to the economic downturn. And we've also seen many countries with relatively good public health systems become overwhelmed with surges in cases because households were not able to adhere to public health measures due to, for example, the need to work, having informal work, and living in multi-generational households. So we need to take a wider multi-sectoral approach, and why the World Bank has committed a record $160 billion to the wider COVID response to protect the poor and vulnerable who inevitably suffer the most from any crisis. Preparedness really requires also investing in social protection systems in schools. We are particularly concerned about the impact of COVID on human capital formation. Our key immediate priorities to contain the pandemic and ensure equitable access to vaccines. But in addition to our health work, our education teams have been totally focused on building resilient education systems, and our social protection teams focused on mitigating the impact of the pandemic on livelihoods and jobs. So I will end by emphasizing that the World Bank is fully committed to this important agenda and to working with our partners and countries to strengthen emergency preparedness and health system resilience. Thanks very much, and I look forward to the discussion.
Gracias, Sara, por excelente
Thank you, Zara, for that wonderful presentation. Now we're going to move over to the presentation of Dr. James Fitzgerald.
Pan American Health Organization. I have the privilege to work with James in his team, and he oversees the PAHO WHO work program in health policy and governance, health systems and services organization, health workforce, financing in health, health research and access to medicines and health technologies in the region of the Americas. As Director of Health Systems and Services, he has led the development of reference policy frameworks to guide health sector reform to achieve universal health based on the primary healthcare strategy in the Americas. He has coordinated the strategies to strengthen health systems resilience, health services organization, workforce capacity, and regulatory systems development, development of medicines and medical products. He oversees the management of the PAHO Strategic Fund, a pool procurement mechanism in the Americas to improve access to public health supplies, as well as the PAHO Virtual Campus, a capacity building platform with outreach to more than 1 million health workers in the Americas. It's my great pleasure to introduce Dr. James Fitzgerald for the next presentation. James, adelante, por favor.
Muchas gracias, Amalia. Buenos días a todos.
Thank you very much, Amalia. Good morning to everyone. I'm going to make my presentation in Spanish. It's a real pleasure to join you today. I convey greetings to Francesca and Zara. Thank you very much for your remarks. This is a timely event for us because next week we will be having meetings with the administration of PAHO and with a number of countries to discuss issues of resiliency for the health sector. On June 10th, there were 70 million reported cases of COVID-19 in all of the member states. The pandemic has really impacted the entire region and has caused an economic and social crisis. Likewise, it has exacerbated the poverty rate in the entire region. I'm going to try and move to my next slide here. Amalia, can you see the presentation? Yes, but the slide has not changed.
Así es. Ok.
There
Bueno,
we go.
el camino hacia la cooperación.
So the pathway towards recovery requires better deployment and better control measures. And we need to also improve the availability of different services. We need to undertake this progressive transition as a response to the pandemic. And we need to ensure that these also improve system resiliency. In 2016, PAHO member countries defined resiliency as a fundamental attribute for health systems that are properly developed and that work adequately, through which key health stakeholders can prepare to face crises and respond to them in an effective way. They also need to maintain basic functions when a crisis occurs and need to be able to reorganize as a function of said crises. So the process of maintaining continuity for health services as part of a program has been gravely impacted in the region. And we see this in chronic diseases and communicable diseases, especially in low-income countries. Starting in March of this year, the Americas region recorded the highest death rate due to some of these diseases. And we've seen excessive levels of mortality as a result of the pandemic, especially in low-income countries. The results related to impacts, and I'm going to mention this period that began in October of 2022, February of 2021. And we see that in the cases of non-communicable disease diagnosis, cancer diagnosis, urgent dental care, and treatment for mental health disorders, we've seen some severe impacts. And likewise, services have suffered some shocks in terms of their availability. So this has affected the system's ability to save lives, and properly allocating the resources necessary to control the pandemic, including the reallocation of resources from other sectors and directing them to the health sector, has become a necessity. Now, the pandemic has really produced some very grave impacts to various areas in the sector. The pandemic has also been disproportionately affected due to pre-existing inequality and barriers to access to services. In many cases, we've seen impacts in the status of people, be they migrants or populations that are already under vulnerable conditions. Now, this has been exacerbated in the health sector, and we've seen that the results in the health arena have been affected very gravely. In addition to the pre-existing inequality, the pandemic has identified important weaknesses in the health systems in the region and discovered that many of these have been improperly managed and highly segmented and fragmented. When we talk about essential functions, we've seen that there have been very scarce improvements. The investment in the sector is only 6% of GDP on average. And when we consider the entire population of member states, this averages approximately 3.7% of GDP. So many times households have to pay very high fees to be able to have access to healthcare. Almost 12 million people end up under the poverty line as a result of these health expenditures. Starting in January of this year, many countries in the region reached a breaking point in their hospital demand, especially in the ICUs. During approximately 1 year, the health systems in the region have seen their capacities overrun, and they've seen the need to maintain and expand their capacity. Now, this leads to a scarcity in healthcare workers, as well as equipment and services to address emergencies. Something as basic as oxygen has been a problem, as well as anticoagulants. So when we consider everything that we've mentioned, what is it that we want for future health systems? The road to the post-pandemic recovery and the pursuit to achieve the Sustainable Development Goals in the Americas indicate that systems that are deemed to be resilient require the recovery of all of the progress made in the public health sector, addressing the inequities due to the impact of the pandemic, expanding the access to healthcare and health coverage in an equitable way, and preparation and response capability that is improved in order to address public health emergencies. So we have a vision of moving towards a transformation of the entire health system. And this as part of our effort to achieve our sustainable development goals. As Zara and Francesca mentioned, the first line of defense that we are proposing is a transformation based on primary care, moving towards universal healthcare. We want to be able to provide services to communities, people, and their families. And we also want to engage more heavily in disease prevention. We want to promote the rapid recovery to the pandemic because this represents a future threat for people. In April of 2019, Dr. Carissa Etienne, director of PAHO, launched the Pact for APS 30-30-30, in which member states committed to participating in this agenda, eliminating barriers to access to healthcare by 30%, increasing investment in the sector to increase to at least 6% of GDP. And we have renewed our commitment to this agenda recently. The second line of action is to strengthen public health capacity through essential functions related to the sector. So this implies designing institutional structures and infrastructures that can manage different public health interactions and do so across sectors. What we really need is better cross-sectoral collaboration and coordination. And these would be based on 4 key areas. In December of last year, we came up with the conceptual framework for this year, and the key areas that we highlight here includes having a better understanding of the population, having a more deep understanding of the different inequities that exist in different populations. We also want to conduct the necessary evaluation, but then move towards promoting policies that protect individuals' health. We also want to develop legislative and regulatory frameworks to be able to address the needs that are identified. And we need to do this at the institutional level to make them more effective. And we need to guarantee free and equitable access to healthcare services. And this needs to apply to all types of populations. The third line that we're working on is strengthening the capacity of integrated health services networks. So routine health services and other services that are working in conjunction with community services. We want to focus on the adaptability of networks that operate in the health network. And it'll be necessary to increase and improve the network resolution and capacity, both at the primary healthcare level as well as specialized services. And we also need to be able to offer the necessary medication when it applies. We need to be able to improve our capacity, bridge the gap to ensure that we eliminate our weaknesses, and we need to be able to improve access to healthcare services and not just collect specific data about diseases, but also have a better understanding of our healthcare provision capability. And of course, necessarily, we need to adopt public policies for the improvement of health sector resources. Something that was mentioned by both Francesca and Zara in their presentations addresses the issue of financing. It's important for us to increase financing for the public health sector, as well as the social protection sector. Currently, the Americas are undergoing a rather precarious economic situation, and we need to see an increase in the investment in the sector to be able to support the recovery for the health system. And the efforts towards achieving 6% of GDP investment in the sector, it will be a key goal, and reducing the obstacles to access to healthcare will become a primary goal for this effort. For this purpose, we need the necessary investment to develop the human capital and institutional capacity. And we need to be able to allocate adequate funding from the public expenditure funds to be able to address these needs. We also need to increase our investments in infrastructure. Lastly, we need cross-sectoral action that is better coordinated to also improve the economies in the Americas. And we also need to strengthen our social protection programs that will protect our populations. We need to work very hard to reduce the poverty rate, and ensure that we foster a proper recovery, not only to ensure better protection for future crises for our population, but we also want to create improvements in not only the health sector, but in the social protection arena. Thank you very much.
Muchas gracias, James, por la presentación.
Thank you very much for your presentation, James. At this time, we will now open the floor for questions and answers. I can see here in the chat that we don't really have that many questions, but I would like to start with one that is directed to any of our panelists. Actually, and all three could share your perspective with regard to this question, because I think that we do have time for this. The question is in English.
The International Journal of Health Governance, I am interested to hear from the panelists what kind of answers they would like to find in the research from our potential authors. What should be the topics and types of our future publications? Case studies, conceptual papers, literature reviews, observational studies, etc., that could help policy and decision makers. And como para el balance de género, le voy a pasar primero a James.
Just to balance the gender makeup of our panelists, I'm going to yield the floor first to James, because our female colleagues are the predominant panelist demographic here. James, you have the floor.
You know, when we were developing the work with the countries in the Americas around this strategy, you'll recall, Amalia, that one of the core issues that constantly came up in our discussions with them was the issue around leadership, stewardship, and governance. And when we were putting together the proposal jointly with the countries, we had discussions about whether it was important to create an individual or distinct line of action in terms of governance and stewardship. But in the end, I think what we heard from countries was that this issue is important across all the areas of work. It cuts across the transformation of health system based on primary health care, on financing, on supply chains, on production of vaccines, technologies. The issue of governance, stewardship, and leadership is really key. And some of the data that we've seen coming out of the stock take in WHO Geneva on the 3 billions suggests an interesting fact, and it's this: the level of preparedness prior to the pandemic is not necessarily directly related to the capacity of response. What we've actually seen is the most critical issue in terms of response to the pandemic has been the capacity of governments in terms of their leadership and stewardship of the overall response based on science. And so this is, I think, a critical area that we need to begin to look at. How we have these distinct mechanisms and, I suppose, various inputs that are necessary for the response, but then how these need to be driven to action through effective leadership and governance, and how we mobilize the scientific community around a situation whereby we can generate the best evidence and the policies necessary.
Thank you, James. Sara, ¿quieres comentar?
Yeah, no, thanks.
Sorry.
I think it's a great question. I would say there's two areas that I think are going to be very important to do further work on and further research. One is that it's linked a bit to what James is saying, but the metrics that we have to actually assess preparedness, capacity, and capabilities. With the metrics that we've been using, we've seen haven't actually predicted how countries perform with the pandemic. So I think that's one key area, and I know also WHO and OECD and the bank, everybody's sort of looking at this. The second one is around sort of the investment prioritization. I think a lot of people are, we can think about what needs to be done, but I think we need to think how we prioritize. And I think a lot of work, and at the bank, we're looking at that, thinking about the investment frameworks of, in countries that have a lot of, they can have a lot of demand in the health sector, but it's not just the health sector. There's obviously other needs in the countries. We're going to have it's a fiscal crisis. How do you prioritize investments and make them context specific? So I think that's going to be another area that's very important. Thank you.
Thank you, Sara. Francesca?
Sure, very much mirroring, very much completely agree on the issues of stewardship and leadership. And that made a huge difference to the speed of reactions and taking this whole of society approach, because moving forward, clearly we need to put issues of crisis and resilience of the health system as very much high on the agenda, the priorities of prime ministers and leaders, not really just of the health sector alone. But perhaps two other things. One is obviously the critical importance still of the health services research, which that can be through case studies, literature review, observational studies, as you mentioned. But we need to understand much more what were the critical elements that made the difference in countries beyond the leadership. And those were not just the things that were looked at in terms of pandemic, purely narrowly thought of pandemic preparedness. It's really that look more broadly at health system and interconnected systems that needs to be looked at. And yes, completely agreed, Zara, we do need to have better indicators and measurement of all those different elements that make a difference in a context of a pandemic. There's probably also the issues more for having more translational research. So really having a much more multi-directional integration between different type of research, whether it's the basic research, patient-centered research as well, population-based research. These elements and aspects are somehow not looked at as much and definitely deserve more attention moving forward.
Thank you, Francesca. I have a lot of questions and comments in the chat, and we are 1 minute from 10 o'clock. So I will ask the three panelists if it is possible to stay for 5 more minutes so that we can run few more questions before we close. Is that okay with you? Okay. Antes que nada, muchos comentarios.
Yes, we have many comments with congratulations to the presenters. They were well received. Now, what I'll do is perhaps join some of the questions, and then I'll direct them to each one of you just to save time. We have a question directly for Sarah. I'm going to read in English.
And Sarah mentioned that the bank is focused on a green recovery. How are you involving the health sector in this agenda? Sarah?
Sorry, Amalia, can you say that question again?
The bank is focused on a green recovery. How are you, the bank, involving the health sector in this agenda?
No, thanks very much. I mean, so part of all our projects, when we process them, climate change is a corporate priority for us. So we actually integrate it in every sort of health project that we do. So, for example, for our vaccine projects, we make sure that the cold chain equipment that we use are actually using sustainable have sustainable energy models. If there's facilities that are built, we make sure that they are sort of resilient to climatic change. We integrate training of sort of the impacts of climate change into healthcare worker trainings. So there's actually a really wide variety of activities that we are integrating directly into our health projects. Thank you.
Thank you, Sarah. Bueno, esta pregunta, Francesca, I will do the next question and maybe you can answer and then I will place one for James. There has been a huge shift in trusting science and evidence. Are there regional variations? How do we regain the trust by the public and some policy makers and prevent the politicization of evidence and science? Francesca.
The easy question.
Interesting question.
Yeah, no, but there is a huge agenda of trust. Trust in governments, trust in science, which obviously has to do a lot with the way government communicates with society. But I think it goes way beyond just the communication. Do, for example, people trust that there is the people that that are making decisions also have the qualifications and the competences themselves. So is the communication done in a way that reflects also competence of governments in addressing issues such as a crisis and so forth. So this whole issues of competence become particularly important. The integrity element, because trust in the context of the crisis has to do with making sure that there is systems which are have a strong standards of integrity. So I think addressing that trust aspects requires really having again a broader look at how government functions in a way that we ensure that not just the communication is clear, is science-based, but also that you build that integrity and competence around the way government functions that build then the trust of populations. There's been clearly then a lot of confusions obviously communicating even basic science in a context in which science was evolving. So perhaps being also much clearer about what do we know already, what we recommend, or what is the policy and action which is made based on the best knowledge available, but knowing that some of the knowledge might evolve as obviously science research and knowledge builds up. I think even that way of communicating in a simple way, that there might be an evolution as well. That is really critically important. So these are just some elements, but it's a huge task, definitely a huge task for the future.
Thank you, Francesca. And the last one, because we are running out of time, it's not the last question, but I will apologize with everybody that we cannot really take more. But this maybe James, you could provide your input. The question is if you think that it is imperative to promote digital health to make traceability more easy in prevention of future pandemics and also to promote prevention in health in general. James. El micrófono, James.
Yeah, thanks.
Gracias.
So thanks, Amalia. That's really a great question. And I think the short answer is yes. we are very much aware, as Francesca presented as well in terms of data in the OECD, but broadly also in the Americas, the massive growth of digital health technologies as a means to increase access and coverage in terms of healthcare. We have enormous opportunities. We've seen that during the pandemic. And just even recently, you know, in terms of the structure and organization of health systems, how we, you know, sometimes when we think about digital technology, we think more of higher, more resource-intensive technologies, but how we bring that down into the communities, into the houses of people, so that they have access to their healthcare providers, and even through community health workers, how we mobilize digital health technology as part of the primary care strategy. One concern that we do have, and again, we are having this discussion with our countries next week, is the barriers to access digital technology. So there is a direct relationship here in terms of income quintiles, in terms of access to the internet. We estimate that over 200 million people in the Americas still don't have access to the internet. So what are the implications as we roll out strategies in digital health technology to address that? We do have to kind of break down and address those barriers as well.
Thanks, James. Bueno, con esto yo creo que tenemos de...
With this, most unfortunately, we will have to close the meeting. But before that, I would like to share with you a comment by one of the participants. I think it captures well the sense of what we have to do, and also to give voice to our colleagues. The comment sends congratulations to all the panelists for your presentations, and then for raising all the problems that the pandemic has raised. And only the high-ranking authorities in public health will be able to reprogram this into integrated and comprehensive networks to give access in quality, not only for COVID, but for all the neglected pathologies. And this is from Dr. Judith Diaz-Bazan from the Ministry of Health of Argentina. I would like to read more contributions, but we don't have time. But to end, perhaps to summarize some key issues, we have observed something really interesting. We have three agencies of great importance about the dynamics of global health: PAHO, WHO, OECD, and the World Bank, and they are presenting their perspectives about a common topic, which is resilience. And it is clear that we have a shared vision, not only of the problems that we have at present, but also of the solutions at hand. And I think that the most important thing is to underline the fact that the three agencies center on primary healthcare as a strategic approach for health systems and services improvement to base interventions that may help us strengthen and build more resilient health systems and services that are able to respond to this pandemic, but to help in the transition and to respond better to all pandemics in the future. This is clear. It has been clearly stated in the presentation. There are many details that we have to work, but this is an important element. Perhaps in this sense, we would like to underline that primary health care as a strategic approach establishes a health vision that has central values on the right to health, the right to equity, the right to equality. And if we take this as a frame of reference, that will allow us to increase investments, to improve health systems and services, and to transform the organization. The third element that I think is important and was very well presented within your perspectives is the fact that even though we have observed great gaps and challenges during the pandemic, we have also seen innovation. We have also seen that the pandemic forced the countries to generate changes in a very short time, and innovations such as, for instance, in the models of care, the use of information technology, and not only technology, but also other changes in the modes of hiring personnel, how we were able to increase the human resource capacity, equipment capacity. So this is a common element, and I think that we will be able to build resilience based on these innovations. And I think the application of this message will be very important. And then that, last but not least, something that is recognized as essential, and that is the capability for stewardship, for governance that has to be strengthened, both at the country level and also at the global level, to be able to foster all of these changes that are substantial in some cases in the way that health systems and services are organized, including linkages to other areas, so that we can have a more comprehensive approach to health of the population. So with this, I would like to close the meeting and this webinar. Thank you very much, Zara, Francesca, and James, for your excellent presentations, and thanks to the participants for having accompanied us today. Thank you so much. Bye.
Thank you. Bye-bye.
Great, thanks very much. Bye-bye.
Thank you, muchas gracias.